What happens if your HIV med stops working? That's what we're chatting about today. Dr. Monica Gandhi joins us. Always good to see you, Doc. How are you?
Thank you. Fine. Thanks so much.
Let's get right to it. We're talking drug resistance. How can you tell if your HIV meds are still working the way they should be?
So if you take them, regularly and every day, then they should work. And the only reason that they wouldn't work is if the virus has developed resistance to one of the components of the medications in, say, your combination pill. And that is the way to tell that the viral load is elevated, even though you're, doing your best and taking those pills every day. And resistance can happen. And we can actually send a test to figure out, kind of sequence the virus and figure out if resistance has occurred.
So, are there any kind of symptoms or signs that I, as the person living with HIV, might start to notice that would be cause for me to think, hang on, maybe this isn't working?
Yes, I mean, usually when people have resistance, again, the virus, it's not the person, it's the virus that's developed the resistance pattern to one of the components of the medication, then the individual living with HIV will have an elevated viral load and can feel that. Yeah, I do think that people can feel the difference between having ongoing viremia, where the virus is actively replicating, versus being unsuppressed, completely
Yeah.
suppressed, and having that virus be totally down low or below the replication capacity of the assay. You want it to just be, undetectable. So you can tell because you'll go in and we'll do a viral load test and we'll say, wait, why is this up? And often people can feel that. And then we just send a resistance test. And there are things that we can do if it ends up being resistant.
Right. And that was my next point. It's important not to panic. This can happen,
Yes.
but we've got backup plans, right?
Yeah. I mean, that is actually a great point, that where we are in the era of HIV is that we have so many options to treat it. And we have talked before that we have oral antiretrovirals, we have long-acting injectables. We're getting more long-acting injectables. But we have had patients in our clinic at Ward 86 where even if they've developed resistance to the long-acting, we have another long-acting that we can pull out and we know what to do. So it may not mean that you have to go back to oral. And then we always have kind of big gun antiretroviral therapies that will work against any virus. We have all of that now. We're really in a different era of being able to treat. So there's absolutely no panic. That's exactly right. But we have to switch if there's viral resistance has developed.
How common is it for somebody living with HIV to have the treatment become resistant to one or part of it's the virus, rather, become resistant to one or part of the drugs? Like, I've been living with HIV for almost 20 years. Is it something that long-term survivors should sort of be checking more regularly?
Actually, it's become less and less common. And so someone like you, who, knowing you, probably takes your medications pretty regularly, you may be in a situation, I hope, that you've never gotten resistance. It's absolutely certainly not a guarantee. It doesn't have to happen at all. The situation in which resistance can develop is if you're going through a hard time and things are hard in life and you're taking the pills off and on, because what leads to resistance is off and on adherence. The drug selective pressure from taking it sometimes 3 times a week or every other day, that actually is worse than just stopping the medication altogether. If you're going through a hard time, just stop everything. And then when you're ready, we'll put you back on. But the kind of off and on, or taking it sporadically, that provides what's called the drug selective pressure to make the virus evolve resistance. And that's what we don't want. So, so there are people, most people do not develop resistance at all. If there is resistance that's developed, it's usually has happened against more of the earlier drug classes. These ones that we're using more now, integrase inhibitors, it's hard to get resistant to them. They're pretty strong and pretty what we call a high genetic barrier resistance. So we don't see it as much anymore.
Yeah, and you mentioned there, we talked about the long-acting injectables. If I have been on a pill regime for a long time, how can switching, what are some of the pros to switching to a long-acting? Maybe what are some of the cons?
Yeah, I mean, the pros, I think, is this idea that you don't have to remember to take that pill every day. And I think people, it's not just, I think it can be if you set a reminder or, just have it as a part of a routine. It's not that it's even hard to remember. Sometimes it's more that you don't want to be in a house and show people that you have HIV, or you feel internally that you don't want to remember that
Stigma.
you have HIV. There's stigma, exactly, external, internal stigma. And so there's a real pro about getting the antiretrovirals injected in the clinic and then going about your day and then going back every 2 months. So that's the pros. But the cons are that you have to get a shot, and there is, the discomfort with the shot. And then you do have to go to the clinic more frequently, because if you take the pills every day, you can go in every 6 months to see the doctor. But if you take the injection, we're now really going towards every 2 months for the injection. Then you can, you have to go in more frequently. But we've tried to streamline that, at least at our clinic, to make it faster when you go in, get it, go out, don't have to see the provider. But there are pros and cons. Everyone,
Sure.
we really just need to provide choice so that everyone has a choice, because we've shown in every area of medicine, if you have choice, it's better for people feeling empowered for their care.
And this is probably, I don't want to go too deep into this because this is probably a separate topic, but if you are pregnant or planning to be pregnant, the injectables are not necessarily always the best course during that period of your life. Am I right in thinking that?
That's changing. So at the beginning, we were like, we don't know enough about these injectables. What if their drug levels will go down during pregnancy or breastfeeding? So let's not use them. That's changing. We actually have accumulating data from what's called the HPTN 084 study that looked at one of these injectables in all women, all cisgender women. And there were pregnancies, and everyone quickly looked at the pharmacokinetics and how the drug levels worked. And actually, it looks like they're just fine in pregnancy.
Good.
So if that's what works for you and you're planning on getting pregnant, then stay on those long acting.
I love that. What are some of the proactive things that I can do to make sure that my treatment is working?
Yes, I mean, we have gone back and forth in this, but it really seems like taking it every day is the right approach. It used to be, oh, maybe you can do 5 days a week. I actually think that every day not only controls the virus, it controls the inflammation from having HIV. So taking the drug every day, that is the best thing you can do. Putting it right next to your coffee pot or whatever it takes to remember to take it every day. And then if you can't, because life happens, think about talking to your provider about long acting. And if worse comes to worse and you need a break, then breaks can happen. I mean, it's not impossible to conceive that you need a break for a couple of weeks. But again, if you need a break, stop taking it altogether. Don't take it off and on, and then we'll get you back on something that helps.
And I think
helps you.
I think important to stress, if that is the option you're thinking, be talking with your healthcare provider and making those decisions together. Don't just do it on your own whim and not talk to anyone about it. I just want to stress that. I think it's very important.
Yeah,
that is a decision you make in partnership with whoever's taking care of you from the medical side.
Yes.
And I guess lastly, Dr. Gandhi, and these go by so quickly, I think it's very important to continue to stress that, a person living with HIV can live a very long, happy, and healthy life thanks to these drugs, whether you become resistant to one and have to switch. Bottom line is, these are important for us.
Truly. Everything has massively changed in the world because we have these short-acting, long-acting, doesn't matter. Antiretroviral therapy works. It makes you have a totally normal lifespan. If you can take it every day and forget about it, your life is actually quite unchanged. And they really work to maintain your health. Please get on antiretroviral therapy.
Dr. Gandhi, thank you so much for taking the time. Always a pleasure to see you.
Thank you so much.
That's going to do it for this episode of Plus Talk here at Plus Life, where we're all about turning positive into a plus. If you want more information, check out the website. And remember, you can follow us across social media. We are at Plus Life Media. Until next time, if you're HIV positive, remember, take your meds. See ya.